Hey everybody, this is Dr. Mario Sakasa here with Faith in Marriage. And so grateful to have you guys with us as we're going to answer some questions about COVID-19. So grateful to have Dr. Jeffrey LaCour with us. So let's go ahead and roll this intro and get started with these conversations.
I'm an ear, nose, and throat doctor in Hammond, Louisiana. And basically, I've been doing a lot of research, over the past week, just kind of trying to figure out what's the best way to stay safe.
Yeah.
What are some things we need to look for? When should we go to the hospital? Should we continue to take these medicines or those medicines? And just trying to kind of put things in perspective. Amidst all the fear and concerns.
Yeah.
And so, yeah.
Super grateful, Jeff, for you coming on and being able to do this. Now, we were initially going to do this with Jason. Just want to say this to everybody. But Jason's having some technical issues right now. Unfortunately, the internet's out in his house, which was a little concerned about that, even in my situation, maybe because everybody's online right now. Everybody's doing Zoom. Everybody's on Netflix. Everybody's doing virtual training. So, we're missing Jason, but we're gonna roll without him for right now. So disclosure. Let's go and get the disclosure out of the way because I know you're a doctor. I'm a therapist, so I know we have to get these things out, so that nobody kind of runs within and says, "Hey, you said something, and I listened to this guy on my TV screen or whatever." Get it out of the way, Jeff.
For sure. No. So look. So basically, this is my information that I have is what I've been trying to keep up with all the current literature through my own academy, my ear, nose, and throat academy, through my rhinology academy, through the internet, through New England Journal of Medicine, and so all of these things new things are coming out daily. And so literally, I stay up at each night and catch up with what's going on. So take all of this as what I'm reading, right? If you have specific questions for your situation, please contact your primary care provider. But so don't take this as gospel, but this is what I've been reading and keeping up with. So
all right. So what are some of the more absurd things that you've been reading that we need to debunk right out of the gates?
Okay, so a few things. I'll leave my favorite one for last, but a few things I've been reading is to go lay out in the sun because the virus doesn't like the sun, and so I do not recommend that. By all means, get out and play with your kids and get some sunlight because vitamin D is important. But do not go get a sunburn because guess what usually comes with a sunburn? You ever get that bad sunburn and then you kind of have that fever later on in the day,
Yeah.
right? That will do not do that. So that's one of them. Don't go lay out in the sun. What else? I think my favorite one is I read that people were telling others to put a hair dryer up to your nose and blast it up your nose and so that the heat will kill the virus. Do not do that. Do not do that. Basically, if you happen to have the virus, you are going to be spreading it better than anyone because it's going to all be coming out your mouth.
Oh
And
my.
so please don't do that. And those are the two better ones I've heard. Some of the things I have heard is drink hot things because it will kill the virus. I think that's a myth. Once the virus gets in, it's already intracellular.
Uh-huh.
So you're not going to kill it by drinking hot things. That being said, is it wise to stay hydrated? Absolutely, absolutely. But this whole thing that came out of Australia, where you drink a lot and it'll wash the virus down your GI tract.
Uh-huh.
What I read about it last night is that's from the specialists in infectious disease doctors, and they're calling bogus on that.
Okay. So not hot things, but what about things that are of high alcohol content? So so we know that we have hand sanitizers right behind me, 60% hand sanitizer. What if I'm drinking something that's 60% alcohol? Will that kill what's in the back of my throat or no?
Okay. I have to defer. I do not know the question. That being said, this is Lent. And my wife told me I still have to keep my promises, right? And so, but trust me, I want to see if that whiskey works. Trust me. And so, so I do not know the answer. Honestly, when I get a sore throat, I'm kind of old school, and my mom would be like, "Hey, drink some Makers. It's going to help you."
Yeah,
So I think a little whiskey, at night is not a bad thing.
got
But I
it.
don't think that's going to kill the virus. But probably not a bad thing. So,
Just help you feel a little
but
better.
don't drink whiskey all day.
Yeah.
Do not just keep drinking whiskey.
So don't drink whiskey all day. Don't sit in the sun and get a sunburn drinking whiskey all day either. Don't put a blow dryer to your nose. Those
Yes.
things aren't advisable. Now,
No.
as an ENT, what if we have sinus troubles? Okay, so what about
That's
like neti pots or nasal sprays, those type of things? What's your advice
great
on that?
question. Great question. So, a few things to be on the lookout for. If you're a typical allergy patient and you use, Flonase or Nasonex, one of those nasal steroids,
Hmm.
you can keep using those. Okay, you can keep using those if they help you breathe. Okay, and if this is how you fight this time of year, pollen season is still there, and so yes, keep doing that. If you're a sinus patient that typically rinses out your nose with saline irrigations,
Hmm.
then yes, keep doing that. Don't stop doing that. If you are thinking that you're going to cure this by rinsing out your nose, I would not start now, because there's probably more risk in doing something like that, and getting it all over your sink and all that stuff. Those of you that are already doing it, keep doing it, and don't fear doing it. Okay.
Okay.
That being said, if you start having loss of smell, okay, that's a big one now. Loss of smell and change of taste is one of the early signs of this. Okay, we've seen that in our own clinic, and across the world, that's been a very reliable symptom. And so, do not use your nasal spray then, because you don't want to. That there's a good chance you have it. Okay, so you don't want to aerosolize by using your nasal spray. And you also don't want to encourage the virus to go further up into your sinuses or anything like that. And so I would say, if you have the virus, if you if you have excuse me, if you have the virus, and sorry, I just got called from my clinic.
Hmm.
If you have the virus, and I would not do those things.
Okay.
I would not do the nose spray or anything like that. So,
Okay. All right. Thank you
so yeah. So
for clarifying. So
if,
if
if
you
and I would say, go ahead. I'm sorry.
no, 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 just that if you are an allergy sufferer and this is part of your normal routine to kind of keep
Yes,
post nasal drip, kind of keeping your sinuses clean, continue to do so. But if
that's
you
legit.
that's fine. But if don't start it now as a regimen,
Don't
is
start it
yeah.
now. And if you're getting the symptoms, and especially loss of smell, you're getting that fever, with nasal congestion, I wouldn't do it.
Okay.
I wouldn't do it.
All right.
So,
So
and it's even more so for other people, as it is more so as it is for yourself.
okay.
So,
All right. Great. All right. What about some other things like smoking? Is smoking a risk factor? Like if people who do smoke, are their lungs more compromised and susceptible to receiving this, or is it something that
yes,
can you could spread it more if you're a smoker? Like what are your thoughts?
that's a great question. So, first question is, yes, I don't know if they're more so prone to getting it, but they are more prone to have serious risk with it.
Okay.
So in China, 50% of the men smoke and 2% of the women smoke. So 50 to 2.
Wow.
Um, the men were more likely to pass away, way more likely than the ladies, and their assumption was that this had to do with smoking.
Okay.
And so so even if you're a smoker now, if you can stop, and I know this is a hard time, it's a hard time to do this, to stop with all the stress and everything. But if you can cut back, your lung tissue can regenerate a little bit, even if you quit for a couple weeks. So I encourage anyone who smokes to really cut back, because those are the patients whose lungs are not going to do as well, and who are more likely to have serious problems with this.
Okay.
So
Thanks, man. This is all
yeah.
great advice here. Great,
And
great.
then Yeah, with regards to can you infect other people, I was looking that up last night and didn't find anything.
Okay.
But my gut instinct is that if you're smoking, it's going in your lungs, and then all of that is coming out. So you're basically, if you have it,
Hmm.
so I don't see how you're not spreading it in your plume of smoke, right? And so my thoughts are, if you're smoking, please go somewhere where it's not going over the neighbor's fence. If there are kids around, like please, like really go somewhere outside where there's not a lot of people, not anyone really. And I think that that's just a good habit for now. So
Fantastic. Fantastic. All right. So one of the question, people are asking about, I'm sure, what about blood pressure medicine and high blood pressure? That's been something that's been talked about as like another risk
yes,
factor or something. What's going on there?
yeah. So one of the concerns is people that take ACE inhibitors,
Okay.
like lisinopril or enalapril. Those are ACE inhibitors, and one of the thoughts is that the virus um, can attach to these receptors, which may be affected in patients that are taking ACE inhibitors.
Hmm.
And so, what I read yesterday was that there's some arguments that it helps patients, and it's some arguments that it makes patients more susceptible. So the party line that I read last night from it was either the CDC or the World Health Organization,
Hmm.
was continue to take your ACE inhibitors.
Okay.
Do not stop taking your medicines now, because what you don't want is to have hypertension and high blood pressure, and you don't want to show up to the emergency room with a nosebleed or anything else, And so I would say continue taking your ACE inhibitor based on what I'm reading.
Okay. All right. Man, it's good stuff. All right. So let's keep. Can I keep? Where's the lightning round? Let's keep firing stuff if that's all right.
Let's do it. Let's do
Okay.
it.
What about Tylenol versus ibuprofen, Aleve, NSAIDs? How do you pronounce it? I always never pronounce it. And
Yes.
non-steroidal anti-inflammatory drugs. I forget how to pronounce that. The actual acronym there. Yeah.
Yes. So a couple things with that. Um, what I've been reading is early on, apparently some patients that were taking NSAIDs like ibuprofen, Aleve, naproxen, um, fill in the blank, Advil, um,
Motrin.
were having worse. Yeah, Motrin. They were having worse symptoms. Okay, and then what I read yesterday was that if you take that, it's okay to keep taking that.
Hmm.
Okay, having arthritis, not being with your NSAIDs is tough. Now, this is amazing how things change. And then this morning, I read something from a reliable website, which is still discouraging patients from taking them.
Hmm.
So if it be me, I would say by all means, if you have a fever, use Tylenol. I would not use any of the NSAIDs. I would try to avoid NSAIDs right now if that's an option. If you're in serious pain and that's the only thing that helps with your pain, then I would defer to taking them if it
Hmm.
were me, right? And so I wouldn't be miserable right now out of fear of getting it and having my symptoms being worse.
Hmm.
You
Hmm.
with me?
Yeah.
But if
Yeah.
there's an
Absolutely.
option, if there's an option, I would take Tylenol.
Got it.
So
Got it.
I would defer to Tylenol. Yeah.
So, but why? Like, what is it about the NSAIDs that is causing more of a problem here with these drugs?
That's a great question. It's something that it may increase viral shedding. That's also a theory behind potentially using steroids right now, like oral steroids, that you may increase viral shedding. And so I don't know the molecular mechanisms behind it,
Hmm.
but that's been observation. I believe it's either China or Italy or France, and it's really cool because we're getting all this feedback from our colleagues across the world daily,
Wow.
and so they're just telling us their observations, which is awesome.
Wow.
And so some of the observations were, yes, patients that were taking NSAIDs, their symptoms got worse.
Mm.
So I can only imagine that means that the virus is having, is duplicating faster.
Okay.
So,
Okay. All right. This is great, man. Thanks so much, man. This is really
oh,
awesome.
my pleasure, brother. My
Okay.
pleasure.
All right. So let's keep going. We've heard at least the symptoms are of the coronavirus. If you start feeling sick, it's a cough. It sounds like a dry cough. I don't know if that's true or not. A fever,
Mhm.
shortness of breath, loss of smell, and loss of taste. I've heard that also. Rudy Gobert, who's the first NBA player to be diagnosed with this, he put out on
Yeah,
Instagram that he was experiencing those last two. If we start
yeah.
experiencing these symptoms, which are the ones that we need to take very seriously? When do we need to go to the hospital? When do we like we should contact our doctor right away, right? If we have any questions and be in communication with them via
Yeah.
telepractice, telemedicine. But
Yes.
like at what point should
Yes.
we be saying I need to get myself to the emergency room?
So this is a great question. Talking to some of my emergency room buddies, what they're what they've told me is anyone who's having shortness of breath,
Mm.
right? That's the big one because that's the one that can get worse fast. And so if you're finding that you're having shortness of breath just sitting down, or with minimal activity, even if you don't have other symptoms, then that's an indication to go to the hospital.
Okay.
That's kind of something not to play around with.
How do we test that? I mean, I know
Now,
we were talking earlier this week, and I know my anxiety, I'm not going to lie, was a little high, I think Tuesday specifically.
yeah,
And I was having a little shortness of breath that I was like, okay, I just need to go on a run. I need to just see if
yes,
is this in my head right now? Am I
yes,
making this worse, or is this legitimate? So I
yes.
went on a run and I felt fine. My lungs were breathing great. What's a safe test to be able to determine if it's just kind of your own anxiety, or if it's legitimate, a coronavirus
I think
situation?
I think that's a good question. And one of the things that was also debunked online was if you hold your breath for 10 seconds and you don't cough, then you're okay. That's been also debunked.
Okay.
Yeah, and so my advice to that is yes, there's a lot of anxiety. People, you know, are am I feeling short of breath? Am I not feeling short of breath? I would just kind of have some prudence and go about your day. You with me? Like take a time out, go do a prayer, and
Hmm.
and and go do something. Right?
Right.
Go like you said. You went for a run. That's awesome. Yeah, but go outside. Go get your mind off of things for a little bit. You'll know if wait, I really am kind of having. It's hard to breathe. I had a phone call um, from a patient last night who had some shortness of breath, legitimate,
Hmm.
like had a hard time breathing. This morning he's feeling better. My advice to that patient was if that shortness of breath creeps back in and then by all means you need to go to the hospital because so I would say there's no tried and true test. People who are asthmatic, by all means, use your medicines
Hmm.
and treat your asthma. But as far as what's the test, there really isn't any. But I would say don't panic if you start feeling like you're having a hard time breathing or whatever. And it very well could be anxiety. Go take a break. You know what I mean? And if this is something that you're fine, you're kind of like, you know what, something really isn't right, and this isn't just my emotions or my fears. Something's not right, because that could be the only symptom,
Okay.
and that's even showing up sometimes. Sorry, I had my microphone blocked.
You're fine.
That's even show that's even showing up before fever.
Wow.
So I would I would caution against being an alarmist,
Hmm.
but after you're real with yourself and a little time goes by, if that's going on, then that's the that's what emergency room doctors are saying. That's when you come in.
Like a few
So
hours. I mean, like if you try your normal things to kind of calm down, whether that's so. Let's say you roll out the options. If you're asthmatic, you take your breather. If it helps, great.
yeah,
If you find that it is anxiety related, and you do some type of mindfulness exercise or some breathing or some exercise to get your mind off of whatever you're afraid of, and you come
yes,
back, you're feeling okay. If you run through those things and it's been a few hours or into the night, you're waking up in the morning and it still hasn't gone away and it just feels
I
a little
I
different, is there or not even wait that long? Like how like
I wouldn't. This is something that I wouldn't. I
okay.
think I would weigh it as far as like, hey, I'm starting to struggle a little bit. Like you're actually aware that I'm having a harder time breathing, period. I wouldn't wait.
Okay.
Like this is like, you know what? I've given it an hour or two. This isn't anxiety. Your body, like, trust what your body's saying. You know what I mean? Like you'll know that this is not a typical panic attack. You know what I'm saying? This is not me being, hyper cautious. You know what I mean? You'll feel it. And because when it's acting on us, so I wouldn't wait through the night. I wouldn't wait multiple hours. I would give it a few hours and really being honest with yourself about something's not right. You know what I'm saying? I wouldn't be a minimalist in this situation.
Yeah.
Like I wouldn't say, I'm struggling, but I'm probably going to be okay.
Right.
No, like because other people may be on the other extreme where I'm going to be fine. If you're struggling, because what we're finding is people that are struggling like that, those are the ones that can go down fast and might need to be intubated.
Okay.
You know, you know, um, shortly.
Okay.
So
So if you have a fever, like try to write it out as much as possible. I think like Sean Payton right now said he had like
yeah,
8 days and now he's been cleared. We know that the
yeah,
Archbishop right now has been diagnosed with coronavirus, although I don't know what his symptoms are. So certainly people we have to
yeah.
be praying for. But if we personally have a fever, we lose some of
Hmm.
the taste, the things we spoke about. Those aren't things that merit an emergency visit, unless the
No,
if the fever is high enough. Should we consider it, or if we can't keep
good
it
question.
down, or
Good question. So something I read yesterday, and this isn't exhaustive, but something I read yesterday um, was shortness of breath, number one.
mm-hmm.
Chest pain, believe it or not. Patients are coming in with what looks like heart attacks,
Okay,
um, and their coronary arteries are clean with a catheterization. And so some patients may even feel like they're having a heart attack. Okay. So any kind of chest pain, like significant chest pain. And the other one is mental status changes. Any kind of, your wife's like, something's not right with him or
mm-hmm.
something's not right with her. So those are the ones that are
She may say that to me
definitely.
most days. There's something there's something right with him
This,
today. Maybe we need to get him checked.
that's awesome. Yeah, today's a good day.
Today's a good day.
So so yeah, so yeah, and then again, use prudence. I mean, if like, yeah, this is gonna, if it's just like the flu can whoop up on us pretty good sometimes.
Right.
So be prepared to ride that out, but again, use discretion. Your spouse notes that he is not doing well. That's where you need to be in touch with your primary doc. You know, because yes, at the hospitals they're trying to limit visits, but I mean, if you find that your significant other or child, heaven forbid, or a parent is definitely doing worse, you want to be in touch with the primary doc. And if there's enough of a concern that this person is not doing well,
Mm-hmm.
and they're not, it's not a cough, but it's like they're not doing well, then that may warrant a trip to the emergency room. If it's the flu and you just feel miserable and you feel achy and you've got the fever and it's then ride that out,
Mm-hmm.
right? Don't go to the emergency room then. But I would use caution. I know I'm kind of skirting around it,
No, I
but
think it's great. No.
yeah,
Obviously, we keep there aren't hard and fasts right now, but we're trying to give people some
yeah,
guidelines. And again,
yeah,
that's what we're doing. We're just offering some
yeah,
general information, trying to help people, give them what they need. Um, so, two final questions here because we're kind of coming into our time. The
sure,
self quarantining. If you don't have the shortness of breath, but you do have the fever, you do have the other symptoms that we spoke about. What does self
yeah,
quarantine look like in the home if you have kids and others
yeah.
around?
So try to limit yourself to your bedroom and your own bathroom. Um, have and I would if you have access to a mask, I would try to have a mask on. And if anyone who is taking care of you, like a spouse, if they're bringing you food, have them wear a mask as well. And if you have windows in your room or windows in the house or doors, keep them open. Good ventilation is key right now. So thank the Lord's blessed us with incredible weather during this time. I mean, this is some of the most beautiful weather all year. So, so open the windows, get that air flowing. That's key. Again, minimal contact. And I'm going to stress the hand washing thing, because I know that's cliche. Warm water with like sudsy kind of soap, because that's how it breaks down the little coronavirus halo. Is the soap, and really literally spend about 30 seconds doing that, and I would do that often, and then if someone's bringing you food, then again, like have them leave it at the door, and then go away, and then you go out and get it, and that's it. You with me? Like really, it's no contact.
Yeah.
And so, but definitely keep those windows open.
Okay.
So,
all right. For how long?
Great question. If you have it, I would say at least until 72 hours, until all symptoms are gone.
Okay.
Okay. And at least a week since the beginning of your symptoms.
Okay.
Okay. The testing, and one other thing, just so people know, the testing sensitivity right now is very low, which means even a PCR test, which is a like a gene test, is only 72% accurate, which means it can be wrong and you could have it 28% of the time. Same thing with and a nasal swab is downwards of 60% positive.
Wow.
You see, so 40% of people are being told they don't have it, but they do have it.
Wow.
So I would say anyone that has these symptoms, treat yourself and self-quarantine as if you have it, because you probably do.
Right.
Even if your test was negative. This isn't a green light to go back to work, or a green light to take yourself out of self-quarantine. So.
Okay. All right. Great, man. All right. Final question here. It's totally insignificant to all the other stuff, but with all the hand washing, our hands are getting drier. Like, what do you recommend in terms of like lotion? If the hands are getting chappy, does lotion make us more susceptible to picking up the virus? If we were to touch a surface, should we wait till night and put lotion on in our hands and then go to sleep? Like, what's the practice there?
It's a good question. Maybe wait till at night.
Okay.
Wait till at night. It's a good idea. Yeah, I'm not an expert on that.
Okay, I know you're not a dermatologist, but
I would say maybe wait. I would say maybe wait till night, just because you don't want to be touching anything with lotion, because that's just gonna, I can imagine that would just keep the virus just kind of hanging out for even longer.
Mm-hmm.
And that's and I'm sorry, one more thing. If you cough or sneeze or anything like that, that virus can stay in the air for 3 hours.
Okay.
Right. So, and then it's staying on surfaces for 24 hours, like cardboard and things like that.
Mm-hmm.
So just be aware of that. That's why and the way we transmit the virus is by either breathing it in or touching something that has it, and then putting our fingers by our mouth or our nose. So I didn't never realize how much I did that until I had to stop doing it.
Yeah, me too.
And so, so I'm not a good poster child for this. So anyway, so I wanted to get that in there. So
that I mean, that's good to know, because I think sometimes, like, even when we go out to the stores, it's like we're afraid that we're just going to breathe it in and have to. It's like, it's not polio, it's not just kind of this airborne. It does stay in the air like aerosol for 3 hours, but during that time it's falling, and so it'll fall into surfaces. So really, like, it's like if somebody sneezes and just didn't cover themselves and just really went it out, and it just stood in the air, and then you kind of walk through it. I mean, all that type of stuff is the concerning, but it's more when you're in close quarters with people. That's my understanding, right? So when you're breathing in and out, that's when you're more likely to get, is if you're in close contact with individuals. Is that right? I mean, I don't want to be given bad information.
No, I think you hit the nail on the head. Okay. I don't think there's reason to panic.
Great.
To go into a store right now. I wouldn't hang out in the store for a long time.
Mm-hmm.
But yeah, you're exactly right. I mean, that's just the odds there are, a lot higher density of particles in a closed room than there's going to be at a Walmart or a grocery store.
Yeah.
Yeah.
Cool.
Yeah.
All right. And that's why being outside's fine. Doing exercise, even if your neighbors are out and about. So, if I can take a positive with all this, it seems like I've seen a lot of, I know that probably there's a lot of fear, but some of the good that I've seen has been that everybody's out in our neighborhood right now. Everybody's taking walks. Everybody's doing things that I didn't realize we had this many neighbors, to be honest. I mean, like, they're all out and about walking. When I go on my run, normally I'm by myself, but I'm seeing a lot more people out. Now I manage social distancing as well. But then even some of the things we're talking about, like bad habits that honestly need to stop anyways, we're being forced to
Yeah.
stop. Wash your hands appropriately. Don't pick your nose. Don't touch your face. Your mama told you don't do those things, and now we're actually having to listen.
Absolutely.
My mom always said never put a blow dryer to my nose also, and so now you're just confirming that.
We can add that to the
We
list.
can add
I'm going to
that
start
to-
telling my kids that today.
Yeah. If all your friends put a blow dryer to your nose, would you? It's
Can you
absurd.
imagine
No.
like families of people out there like with blow dryers in their noses right now?
No, but I mean on Facebook, everybody's an expert right now. So that's why I wanted to actually have an expert, to see like what is it that
Yes.
actually works and what doesn't. So
Yes. I think you hit the nail on the head, Mario. I think it's important to maintain a level of peace.
Yeah.
You know what I mean? And that's what I'm doing. I mean, I'm trying to intentionally pray every day, right? So fear doesn't overcome. And take the positives out of this. Incredible positives,
Yeah,
right?
amen.
Like you're saying, people getting out, going about, neighbors, family bike rides every day.
Yes.
It's awesome.
It's awesome, man.
So God is good, and He's got us, as
Amen.
you know.
Amen.
And I'm just realizing He loves us so much, and so it's like, all right, Lord, you've got this.
Amen.
So, let's not give in to fear, and let's surrender and trust, and that's what I'm trying to do.
Well, that is a perfect way to end it. So, Jeff, thanks, man, for your time. I appreciate it. I hope it's been helpful.
My pleasure.
One comment we got here was from Father Bro. Booker's is great over 60% bourbon, so I've heard. Wink, wink. So
Tell them that's awesome.
Booker's didn't pay us to say that, so we're no royalties. All right. God bless everybody. Stay safe and keep those hands being washed. All right. Appreciate it.
God bless you. Thanks, Mario.
You got
See
it.
bud. Bye-bye.